Hello, my name is Michael Miedema, Director of Cardiovascular Prevention at the Nolan Family Center for Cardiovascular Health, the Minneapolis Heart Institute Foundation. Here in the Nolan Family Center, we are committed to helping prevent heart disease before it happens by conducting research and helping educate people about what they can do to avoid heart attacks and other cardiovascular events. Today we're going to talk about fish oil. It's a very popular supplement. Roughly 1/3 of my patients take a fish oil tablet daily. So the question is, what does the science actually tell us about fish oil and heart health? Is there a benefit to taking a supplement? Fortunately, there are a lot of good studies to look at, and the results are pretty clear. Like with any medication or supplement, it's very important you understand the benefits and the risks before you and your provider decide if taking a fish oil supplement is the right choice for you. The interest in eating fish and the potential health of fish oil goes back to the 1960s and the 1970s, when there were reports that dietary fat intake may be linked with heart disease. And this made sense as blockages that build up in the arteries are made of fatty, cholesterol-filled plaques. However, there were two researchers from Denmark that said, wait a minute, we've been studying a native population in Greenland, and they have a very high-fat diet, mainly from seafood, and they don't seem to have any heart disease. This raised the question about whether different dietary fats might have different risks and benefits. So when we talk about fish and fish oil, we're talking about intake of omega-3 fatty acids. Pretty much all fish have some omega-3s, but there are a specific group called the oily fish that contain the highest amounts. And those particularly high in omega-3s include salmon or other fatty fish such as trout, tuna, sardines, and herring. The American Heart Association recommends eating 2 fish meals weekly, but what many people wonder is, should I take a fish oil supplement as well? A quick look at the fish oil supplements and the research behind them helps provide the answer. In medicine, if we truly want to understand the benefits and risks of a treatment, it's really important to do a randomized trial. This is where you take a big group of people, randomly split them in half. One group gets the real treatment, while the other group gets a placebo. That is something that looks like the real treatment, but doesn't have any of the real treatment in it. For fish oil, we're very fortunate. We have 6 large randomized trials that have looked at the heart health benefits of fish oil. The studies involve different lengths of time, people of different ages, sex and ethnicity, and people with and without cardiovascular disease. None of these trials showed improved cardiovascular health by taking fish oil. The studies conclusively show that, on average, for the general population, there is not a significant benefit with taking fish oil, even if you're at higher risk for cardiovascular disease. Most individuals can stop taking their fish oil supplement. However, if you're an individual who does not eat any fish, a daily 1-gram fish oil supplement is reasonable. If you have high triglycerides or are at high cardiovascular risk, talk with your doctor about whether a certain prescription fish oil may be a good option for you. Since we know that omega-3 fatty acids are an important part of a heart healthy diet, what can you do? It's easy. Eat the real thing. Individuals who consume fish 1 to 2 times per week have been shown to have a reduction in sudden cardiac death compared to those that eat no fish. However, people that consumed fish 5 to 6 times per week didn't seem to do any better. There wasn't any incremental benefit. So you just need to get some. Getting more isn't necessary. Thanks for your time. I hope you found this video helpful. Here in the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute, education is a core part of our mission. So I encourage you to share this video with your family and friends and anyone else you think could benefit from this knowledge. You can also check our website for other educational materials. Thanks again and stay heart healthy.